Hi everybody. Before we get started here, I just want to go ahead and introduce Miss Kelly Wills. So she is the Director of Volunteer Resources at Dayton Children's, and she is going to talk to us a little bit about their volunteer programs at Dayton Children's today. So Kelly, do you have anything that you want to say before we start asking questions here?
Yeah, we here at Dayton Children's, we can't function without our volunteers, and they are such an integral part of everything we do in our mission. And so we are always excited to talk about our volunteer opportunities and how, especially the youth, can get involved. We offer a lot of great opportunities, and so I'm forward to sharing.
Okay, so we're all ready to start. So today I have CHRISSIE Richards with me from the Kettering Health Network, and she is in charge of their volunteer department. So we wanted to say thank you first for joining us today. And we can just go ahead and jump on in.
So for our teens specifically, we offer what we call our volunteer program. And this is for teens who are in high school from the ages of 16 to 18. We do ask that teens are 16 by June 1st of every year that we hold the program. And we place teens in about 25 to 30 different departments throughout the hospital. These volunteer roles are, some are very clinical focused, meaning they're actually engaging with the patients, whether it's through our child life department, helping kids focus on just being kids, or doing play activities, engagement opportunities. We have some if we have 18-year-olds in our emergency department, so again helping with distraction and just catering, making sure that our families are doing okay in what could be a scary time. But then we have a lot of volunteer opportunities for teens, maybe in more back end roles, helping some of our outpatient clinics with some clerical duties. We use a lot of teens in a wayfinding role. So, as you can imagine, coming into a hospital can be very scary. So, our teen volunteers are a great asset in helping families navigate throughout the hallways. We've used teens in face painting and doing some fun activities with the kids and the guests here at the hospital. So a lot of variety of opportunities. Again, many are clinical focused, but they all support the mission of our hospital and what we're accomplishing for kids.
Sure, I'm happy to. So we have multiple volunteer opportunities here at Kettering Health Network. We have 8 hospitals, 8 facilities, along with standalone emergency facilities where we have volunteers that help with our staffs, patients, visitors. We have anything from welcome desk volunteers to patient escorts to emergency department volunteers, patient ambassadors that work on the floors that help with taking care of the patients, warm blankets, things like that. Um, we have mail delivery, flower delivery, card delivery, gift shop. In our cancer center, I mean, we have so many opportunities. I could go on and on.
So we do ask a commitment of a minimum of 9 weeks for the summer, and we do place volunteers in one shift per week, which is typically a 2 to 4 hour time frame. So by the end of the summer, most of our teens have completed a minimum of, um, you know, 30 plus hours. Um, and we hold an orientation that is it's mandatory. Typically, we do that in May, and that's a way to inform teens of our policies and procedures. We do require teens to have a TB test, which we do here. But even before that, we have teens apply on our website. And this is oftentimes such a popular program in the community that we get a lot of interest, sometimes beyond what we can take. But we are looking for great candidates who have an interest in whether it's on the clinical side or even the non-clinical side of working in healthcare, and providing this opportunity to give back while gaining that knowledge. So we do put our application for the program on our website the first week of February. We do keep it up for just 1 week. Typically during that time frame, we get over 100 applicants, and then from that point, we schedule an interview. Again, we're looking for the best candidates that can commit to the program for our time requirements and have a passion for working with others here at Dayton Children's. So once selected, then
Wow.
our volunteers are placed in a role. We try to find a good fit with, future education goals, or maybe, even opportunities that we feel the teens have skills or capabilities to assist with. And then as far as starting, the teens start typically after they end school for the year and then continue volunteering up until when they go back to school in the fall.
Okay, so it sounds like it's a very manageable time commitment if a student was interested in sort of having a part-time job as well and maybe making some money over the summer, but also getting some experience in the medical field as well. So that's really
Absolutely.
good.
We have a lot of our teen volunteers that, have between sports camps or um, vacations or other commitments, and job being one of them. They are able to balance and still commit to our program and while participating in those other activities as well.
Okay, great. Well, thank you for that information. It was very helpful for our students, I know, to hear that.
Sure. So when we have students that are high school students, or even some of our college students, often their days are busy with school and classes. So they are more of our nights and weekends is what they're typically more interested in. So usually it's a 4-hour shift. And so it's something that they might be able to come in and work a 5 to 9 or something along those lines, or on the weekends throughout the day. But some of our college students, they can come in and work during the day. But usually our volunteer shifts are 4 hours, and we have mornings, afternoons, nights, weekends available. And often it's once a week, but we do have volunteers that I mean, we have some volunteers that come in 5 days a week, and some volunteers that work 8 hours a day. It just depends on what they are able to commit and what their schedule looks like. It's really almost we can work with almost any schedule, to be honest.
If you are a student that's interested, what is your application process like for applying to be a volunteer?
Sure. So really, you just need to go to our website, which we can obviously include here, but it's just ketteringhealthnetwork.org. And then we have a link up at the top where you can click on jobs, and then you drop down to the volunteer opportunity and click on there, and it'll help connect you to the facility that you're interested in volunteering. And you click on that facility, and then it'll take you straight to our online application, which you would fill out. And then within several days, somebody would give the student a call back and set up a time to come in and interview for a volunteer position. At that point, we talk about the different opportunities that we have, the availability of the applicant, and we work to try to connect to the right place within the facility in the right position. And then they would go through an orientation prior to volunteering. We have, they are in person right now, but we are working on a virtual option right now as well. And we do have some employee health requirements, which are aligned with the volunteers, that we go through a health screening, and then we get them on board.
Great. So you did mention COVID, and obviously we'll be, showing this video when this will still be something that is a big consideration. And so are you all currently accepting volunteers, or is your program on hold at the moment? What is sort of your expectation there?
So we are currently accepting volunteers. At this point in time, with the current situation, we are not onboarding any minors, or any of our current volunteers that are minors are at this point in time not able to volunteer. We're hoping at the first of the year that that will be different, and we'll be able to bring some of our younger volunteers back into the facility. But with the situation being so fluid, obviously we just don't know at this point in time what to expect. But we really miss our teens. We miss our, younger volunteers. They bring a different level of excitement and joy to the hospital. So we're looking forward to it when the time is right.
Yeah, we all have our fingers crossed for sure. Hopefully, we can
Yes,
get students back in. And so,
yes.
I guess I just have one more quick question, sort of about your application process and that side of things. What is the age range or like range of students that you all will allow into your facilities?
So we just ask that all of our applicants need to be at least 15 years old. So once they're 15, then they're able to apply. So, and then
Okay.
we accept anybody, be it, or are willing to interview anybody that's at
Mhm.
least meets that 15-year-old requirement.
For students that are thinking about getting into medicine or getting into healthcare, they might be like really excited to get into that sort of hands-on working with patients, like, doing the things that they see a nurse do or a doctor do. And, that's not necessarily what you will see at all of the volunteer opportunities. So, you have some areas where you mentioned more clinical, but also some more wayfinding things that are really helping the hospital flow. And so, would you mind just talking for a moment, sort of what the value for these opportunities can be for students, even if they aren't necessarily, in a patient facing role?
Absolutely. And I'm glad you referenced that. While we do provide some wonderful opportunities that showcase great exposure to the healthcare environment, ultimately, sometimes those roles aren't super glamorous. We don't have volunteers in our operating rooms or, side by side working with the doctors. However, on the flip side, what our opportunity provides is just great exposure to the inner workings of our team members here. It could be seeing the interactions of our nurses or our therapists, or our patient registration staff, and then even our physicians. Seeing that, interacting with them again. It may not be actually in the operating room, but it will be interacting with them, in the clinic space when you're helping with a filing project. And that value is huge. You think of all your peers that are um, maybe looking for opportunities as well, or for have that interest. And when you're able to participate and be in the hospital setting, or healthcare setting, and you have that career interest, it's going to set you apart from other peers who have not participated in person. Um, and so the value is significant. A great resume booster, a great booster for you know, at that point when you are interviewing and can share your experiences and uh, things that you've learned as a volunteer.
Oh, absolutely. So, what is great for any student that is interested in healthcare is just, first of all, just getting the exposure to working within a healthcare facility and volunteering their time. It gives the students an opportunity to work directly with patients and to get an idea of what that feels like. It also gives them a chance to just take a look around and see what type of opportunities are out there. We've had students that have come to volunteer thinking that they were going to go one direction in the healthcare industry. And then they realize, actually, I didn't even know this position existed. And that really, I'm really drawn towards that. and they end up going, they're still in healthcare, but they're going in a different direction. Um, so, and it also, we've also had students that get in and start volunteering and realize healthcare is not for me. I thought that's what I wanted to do, but once I got into the healthcare setting, I realized not direct patient care, is for me. And but maybe they find out that there are other opportunities within healthcare, such as my role, that is does not involve direct patient care, but is still something that's very essential within the healthcare facility. So it just, I think exposure and awareness to all the different opportunities out there is probably the biggest benefit of all.
For working in these positions, there's not just sort of value for the students, as you mentioned in the beginning. This is really important for the hospitals and patients as well. So I was wondering if you could sort of speak to that for a moment and talk about like what these students would really be doing for Dayton Children's.
Yeah, yeah. So we pride ourselves on many things, but one of the things we do, almost one of the best things, is providing customer service and providing a great patient experience for our patients and families. And as you can imagine, being in a hospital setting can be a scary experience. If you're not feeling well, or you do have to have a surgery or a procedure, that could be scary as an adult, but as a child, that's amplified even more. And so when we have volunteers who are giving of their time and able to do the little things, it's helping provide a wagon or wheelchair when they enter the hospital to help them transport from one area to the next. Actually, physically escorting and providing a friendly face and conversation for them that takes their mind off of why they're here. To the to more of the back end roles, helping a clinic staff file patient records, which allows them to then focus on the services they provide that are more professional in what they've been trained to do. All of those roles are essential to helping the flow here at Dayton Children's and help us again focus on providing the best experience for our patients and families. So volunteers are so valuable in so many regards. We can't count the ways, actually.
Oh my goodness. We would not be able to function without our volunteers during regular times. During the critical, like the real shutdown during COVID, where we were not doing any elective surgeries, and we were very, it was just very limited. We also did not have our volunteers here during that time, and they were greatly missed. Even though our volume was lower, they just we just could feel that they were not here. And even now, we have less volunteers just due to the current situation than we normally do. And we're scrambling a little bit to fill in some of those roles. So our volunteers really fill critical roles, working at our welcome desk, working and discharging our patients. At the Kettering campus, for example, our volunteers discharge between 80 and 100 patients a day. So they go up and they get the patient and they take them down to the door. All of this takes pressure off of our staff. So when our staff have volunteers there to support them and help them, it takes some pressure and stress off of them, and really just helps with their overall well-being. It also is a financial savings for the hospital, so it does help financially, which then we can take some of that money that we're saving and put it back into the hospital to help get the best equipment we can, and the best resources we can for the care of our patients. So there's just so much um, value to our volunteers. We're just so grateful for them.
Sure. Yeah, I do want to mention that we do have a coordinated job shadow program, and this program is um, for juniors or seniors in high school, as well as those in college who are exploring careers in healthcare, to kind of get your feet wet a little bit and do a shadowing day here at the hospital. So what that looks like is we do offer 5 hours of shadow time with non-physicians, so anything from nurses to physical therapists to um, uh, X-ray technologists, lab techs. We try to find a best fit, but certainly many clinical roles that we can help connect students with. Um, in addition to the 5 hours of shadow time, we also provide some education on that day that includes information from our employee experience human resources department on careers in healthcare. They offer their information on maybe specific jobs, or are it's a great way to ask questions about maybe an education pathway that they would recommend. In addition to our chief nursing officer always does a welcome, and we provide lunch. So this day is great opportunity again to kind of get get in and see maybe what you're thinking um, in the healthcare world is something that you actually want to pursue. So what that program looks like right now with COVID, it is on hold, but we are hoping to start the program back up in 2021. We do offer set dates. Typically, we offer about 4 a year, and we allow 20 students to participate at each of those sessions. And we have a packet that we can send to any interested student to complete, and it asks for does ask for a reference and some completed health work information, as well as an information sheet. But pretty easy to complete, and once we have that packet received, then we confirm a placement in that particular date.
That sounds like a really amazing opportunity. I know that's really important, just sort of learning what the healthcare field is like and getting your feet wet and learning what these different people do. So that seems like a really great opportunity as well.
It is,
Great.
and I think it allows students, especially if sometimes we have students come in and they are pretty sure they want to go into nursing or another field, and after spending a day, that it sometimes helps fuel that passion. They realize, oh yeah, I love it. I love the environment. I love watching what they do. I love knowing that I can help others. But then sometimes it does the opposite. May causes some extra thoughts or thinking, I saw I was working with the nurse or I was observing the nurse, but I actually I was interested in that respiratory therapist that came in and helped with the patient's breathing. So sometimes it spurs on some other thoughts or even exposure that maybe they weren't aware of previously. So very beneficial.
Yeah, incredible.
Absolutely, and you can't research enough is my advice. You
Yes.
take the time now, explore, 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 and gather information and network, and we will help. It will help you make those decisions. Before you jump into schooling.
All right. Well, we so appreciate your time with us today. And thank you so much for talking with me. And hopefully, we can get this out to students here soon and they can learn a lot from this. And I know that we will also be providing some links and additional information in under the comment section with the YouTube video for students to follow through if they are interested in um, anything that you've mentioned today, any of the programs you've mentioned today. And yeah, we would just really like to thank you for taking your time to talk to us. And we're all done.
All right. Well, thanks for having me.
I would just encourage you to reach out to a healthcare facility, whichever one of your choice, and explore the volunteer opportunity because it truly is the best way to start to build your experience in a healthcare environment. It is something that there are even jobs that you start as a volunteer and then eventually It can lead to some employment opportunities within the healthcare facility for our younger generation while they're going through school. If they're going to college, there could be potential job opportunities for them there as well. But I think just getting their foot in the door and starting to see how the healthcare system works is crucial if they're thinking
Mhm.
about going in that direction.
Yeah, great. Well, thank you so much
Yes.
for talking with us today, and I hope that this helps some of our students figure out if they want to start volunteering